Labor and birth. Labor is the process of giving birth to your baby. It usually happens in 3 stages. The first stage of labor is when you are having regular labor pains or contractions and the neck of the womb or cervix is opening. The second stage of labor is when the neck of the womb or cervix is fully open and you push the baby out. The third stage of labor is after your baby is born and the placenta, or afterbirth, comes out. For most women, labor will start with labor pains or contractions. These are period-like pains that may be irregular and mild. As your labor progresses, your contractions become longer, stronger, and closer together. When you feel your contractions starting, you should contact or go to your local healthcare facility. For some women, their waters will break before they start having contractions. The water is normally colorless. It is important that you go to your local healthcare facility when your waters break, even if you are not having contractions. It is even more important to go as soon as possible if the waters are pink, green, or smelly, or the baby is not moving normally. During labor, the healthcare worker will ask your permission to check your pulse, blood pressure, and temperature. They will feel your abdomen or tummy to see which way your baby is lying and listen to your baby's heartbeat. Every so often, during your labor, the healthcare worker may ask to do an internal vaginal examination. This is to see how open your cervix is and which way the baby is facing. This tells the healthcare worker how close your baby is to being born. You can try being in different positions in labor, like walking, kneeling, squatting, being in all-fours position, or lying on your side. Moving around may help the pain feel better and help to make your labor quicker. You may have a companion with you in labor, such as your partner, mother, or friend. They can help support you by offering comforting words, helping you move, rubbing your back, and offering food and drinks. The early phases of labor, which is called the latent phase, can last a very variable amount of time. You are in active labor usually when the neck of the womb is 5 centimeters dilated. When the neck of your womb, or cervix, is fully open, or 10 centimeters open, you are in the second stage of labor. This means you are ready to push. You may have a powerful urge to push, which might feel like you need to go to the toilet to have a bowel movement. Once the baby's head is born, it usually takes only one more push to deliver the rest of the baby. Most babies are born within 1 to 2 hours of pushing. If it is taking longer than 3 hours, your healthcare worker will check you to find out why. If something is slowing down the birth of the baby, you may need help from a healthcare worker. When your baby is born, the healthcare worker will rub and dry the baby with a towel or cloth. Drying the baby helps them to stay warm. The healthcare worker will place your naked baby next to your skin. This is called skin-to-skin contact. Once your baby has been born, you need to give birth to your placenta, or afterbirth. The healthcare worker should ask to give you an injection to help with this. After the injection, the healthcare worker will press on your abdomen, or tummy, and pull on the cord of the placenta, or afterbirth, to help it come out. After you have delivered your placenta, you will notice vaginal bleeding, like your monthly period. This is normal. Often women have vaginal tears. Your healthcare worker will check to see if there is a tear and tell you if stitching is needed. Normal labor and birth are safe for most women and babies. It is important to have trusted companions and healthcare workers to look after you during this time.